I have someone come in my office yesterday, and they say to me, I have a long history of being on opiates. I was an Oxycontin addict. I did blues, which is roxicodone, 10 blues a day, which is 10 30 milligram tablets a day, he said, for years. And I've been clean for 5 years now. I said, congratulations, that's really good. He said, but I was in a car accident, I hurt my shoulder, and I'm getting major shoulder surgery, and I'm worried about the pain. What can I do? And I said, well, I think you're aware that if you go back on opiates again, it could start your addiction cycle all over again. It does something to the brain. Once someone touches those opiates again, who's been on them in the past or has a propensity towards addiction, it just starts the whole cycle. Their addiction starts off right where they left it. He goes, I know, I heard my friends talk. I think that's what'll happen. I said, yeah, that's probably what'll happen. You can't do that. He said, what can I do? Well, I said, there's something we can do. He's currently on nothing. I said, you could use buprenorphine for pain. And normally it's 4 milligrams twice a day. We use that to block opiate craving. It's a drug used to prevent the craving for opiates to anyone who doesn't know. But in high doses, sometimes 16 milligrams twice a day, or I've taken it even more, 16 milligrams 3 times a day. And I pulse that up for 4 or 5 days after surgery, sometimes up to a week. He said, well, that would be a good idea. But he said, I heard that wasn't the best pain reliever. And I'm like, you're right. It's not the best pain reliever. We'd probably have to do other things. And he says, what else could we do? I said, what I wind up doing, it gives enough pain relief. I alternate with ibuprofen and acetaminophen, which is Tylenol. The most common areas I use it for are shoulder, knee, back, and hip. So those are the 4 areas of surgery of concern. That's where people get surgery the most, and it's usually orthopedic surgery that's the most painful afterwards. So I can cycle up with the buprenorphine high dose for 5 days. I use muscle relaxants because most of the pain is from muscle spasms. So I use methocarbamol, which is Robaxin, baclofen, dantrolene, cyclobenzaprine, that's Flexuril, tizanidine, scalaxin. Those are the 5 I normally do. I try and keep away from the benzos, which are more problematic in terms of addiction, like Klonopin, Valium. So I use those muscle relaxants, and I use a sleep aid. I give them either Trazodone or Ambien for sleep. I haven't run into problems with that. Usually the pain is made worse because you can't sleep. It keeps you up all night. So the combination of high-dose buprenorphine for 5 days, the muscle relaxants, alternating Motrin or ibuprofen and Tylenol, acetaminophen with the muscle relaxants, that's the best you can do without using a pure opiate to treat pain. I think that's your best bet. I think no matter how much pain you're in after surgery, don't take an opiate. I just don't think it's worth it. You could really take a lot of this buprenorphine. It's very safe in high dose. Just do that for 5 days. Most of the procedures, if not all, 5 days, within 5 days, the most painful part of a surgery on shoulder, back, pelvis, and knee is over. So I get people through it with that. And this was a mother calling me, and then the son came in, and this was my recommendation, and I've done it many times, and it works. Thank you.